Have you ever thought about an issue and said to yourself, why should I care? It doesn't even impact me. Well, think again. I'm Natalie Bencivenga, and I am back with another chance to dare to care. This show hopes to inspire so that we can see the connections between issues impacting our communities and find ways to activate to make a difference. My latest guest is here to discuss welfare reform and why cash assistance is an issue we should all care about. So I am joined with Rochelle Jackson. She is the director and the founder of the Black Women's Policy Center and the Black Women's Policy Agenda. Hey, Rochelle, how are you today?
I'm good. How are you?
I am very well. And, this is an interesting year we're heading into now with 2024, with the election cycle. There are a lot of issues that are being brought to the table that are important. But with Dare to Care, I really wanted to bring attention to an issue that I don't think people have much understanding
Mhm.
around. And when I first started working with you many years ago, I learned so much about what you do and how it not only benefits Black women, but of course, how it benefits all of us. And one of the issues that we've talked about in the past and worked on together is TANF. So, can you explain a little bit about what that actually means and a little bit about how you got connected to this issue?
Absolutely. So TANF is, most people may probably understand it or know it to be called cash assistance,
Mhm.
or welfare, right? And so it's had a couple of different iterations throughout, the years, since the war on poverty, right? It was created, it was AFD, and then it was AFDC, and now, in 1996 it was reformed. And there have been many attempts prior to 1996 before it was reformed, but it is commonly what is known as cash assistance, and it is intended to provide assistance to those of us amongst us that are the most vulnerable, who are experiencing extreme poverty, right? So it's not a large amount of money; it's a small amount of money to meet people. It's part of the safety net that was created with the war on poverty, right? And so the intention was to catch folks and keep them from falling through the net, to catch them when they are at their lowest point, financially or economically. It is typically for single moms and children. However, there are provisions that will support intact families as well. But 99% of the people who utilize and who need the benefits are single moms with children under the age of 18. So that was its initial intention. And it has historically has been rifled with a lot of stigma,
Yeah.
unfortunately, and a lot of bias, particularly towards Black women. And so it is something that, for lots of reasons, that there's a lot of shame associated with it.
When I was talking to you about this a while back, there is so much stigma around the word welfare, but when you don't need something like that, a program like that, why should you care about it? But you have had your own personal connection to it.
Absolutely. So my mom was a single mom. She raised me and my brother, and she worked, believe it or not. And so I say believe it or not because most people think we don't we don't work. That that we're lazy. But she did work, but she needed assistance and she needed help. But because of the stigma attached to it, as a child, I always grew up thinking, I'm never going to have, my kids are never going to experience this. I'm not using welfare. This is not part of, what I want to, because I didn't really, to me, it wasn't associated with just there was no pride, there was
Yeah.
no, it was shameful. And so it was the one thing that I, really committed to not doing. However, I got married at a very young age, found myself in a domestic violence relationship in my marriage, and I needed to leave that marriage for the safety of myself and my young child at the time. And I was in school full time, was only working part time, and ended up having to drop out of school in order to get us, to make the transition to safety and things like that, and found myself in financial need. And I did the one thing that I said I would never do, which was walk in the doors of the welfare office. But in hindsight, I can now say that that was the thing that saved me and my child, right? That it was a safety net for me. It caught me in the most, one of the worst times of my life.
How did that feel to not only have to walk into that space and ask for support, but then also to be able to receive that support?
So, even though I personally had some, reservations about walking through those doors and asking for help because of the shame and the stigma attached to it, in my mind, I imagined that when I walked through the doors, that there would be, folks with welcome arms that would say, "Good morning. morning. How are you? How can we help you? We
Right.
are here for you. What do you need? We can, whatever we can do, we're gonna, and that is exactly what not did not happen. Right. So I walked through the stores. And the stigma that I was feeling was magnified by the customer service, the treatment that I received in that office. And so that magnified, so now I understood. I had a different understanding of the stigma and why people avoided it, because it wasn't necessary. The stigma was even, portrayed, perpetuated through the people who were administering the program, right? They
Right.
made feel ashamed for having to walk through those doors and get help. So I had two things. One, there was a place for me to go, right?
Right.
This is a new start for me and my daughter. So I was optimistic and I was hopeful. But then I also had this horrible experience, right, of walking in and being made to feel like a failure,
Mm.
and not being received with open arms. And so, and then my whole experience, I felt like I had to fight for what I needed in order. For me, it was a stepping stone. It was never
Yeah.
intended for me to stay there. It meant for me, it was a bridge, right?
Of
From
course.
one
Yeah.
one point in my life to the next point. So my natural tendencies to be an advocate, was really where I kind of got my feet, in advocacy, because it starts with yourself.
Yeah, it's we're all paying into this for this exact reason.
Yes.
And someone is having a hard time. But what I find interesting, because I'm looking at my notes right now, it's I think people have this misconception about how much money
Oh
one
my
is
God.
receiving, right? There's all the trolls online that, talk about, oh, they're just sitting at home cashing these big checks. When I looked up the value of how much you get for cash assistance, I was actually shocked at how little
Yeah.
it really is. So, for example, to be
Yeah.
eligible for cash assistance, your income must be below the cash grant size. So that's $205 a month for a single person, $316 for two people, and a whopping $403 for a family of three. And also your resources, which means things with cash value, such as bank accounts, bonds, or property that is not your primary residence, must have a value of $1,000 or less.
Right.
I was shocked at what you need to not have to
Right.
even qualify for this. Has that number been increased or raised, or what are your thoughts on that?
Yeah. So you literally have to be rock bottom. I mean,
I
that's
mean,
the
you're that,
literal
yeah,
definition of rock. You have nothing, right? And you are
yeah,
not it makes you an and so it has not been changed. The welfare was reformed in 1996.
hmm,
Shortly after that, in Pennsylvania, we had a cash grant increase, and we have not had another cash grant increase since 1996. So when I gave you that story of me walking through those doors
yeah.
of the office, the cash grant then was $316 for two myself and my daughter, and today is still $316 for a single mom and one child. That's a month. That's in 1 month, right? I know
That
people.
won't even cover utilities in
No,
some
no,
places. I mean,
no.
truly.
No, and we're talking, and so just to put it into perspective, we're talking, you have to get diapers, you have to get wipes, you have to buy over the counter cold medicine, or
Yeah,
feed, if your child is teething and needs medicine, to handle a fever. That's, your toiletries, that's, laundry detergent, all of these things comes out of, and that's not even bills, right? We're not talking
right.
about utility bills, we're not talking about rent, we're not talking about phone bills, we're not talking about transportation to get to doctor's appointments, you know what I
Right.
mean? The things that you need to do in order to put your life or keep your life together. All of that is supposed to, you're supposed to be able to do that with $316. Now, granted, I'm not advocating,
Right.
right? That
Right.
we provide, a grant that allows people to, to just hang out and, and to get rich off of welfare. But $316 is absolutely unreasonable.
Well, and also it's over a lifetime, you can only access it for 5 years total, right? So, that's either 60 months in a 5 year period. But I started thinking about that and it started really connecting me to all the other issues that we have because God forbid, what if you're diagnosed with an illness or God forbid you have to take care of a family member and now you can't work, right? So that's only 5 years in the whole scheme of someone's life that they can access this program. And like you said, it's for such a minuscule amount of money that hasn't been raised. It's
Yes,
also tied to the fact that we haven't had a raise in minimum wage. It's still stuck at a starvation wage of 7.25. So you could have people working full time and still needing cash assistance. Do you ever come across that in your advocacy work when you're working with women who need
yes.
support?
Yes, because I've seen families where there maybe is a mom and she has maybe 5 or 6 kids. In that case, and she's making minimum wage,
Sure.
working part-time, she would still qualify for cash assistance because she's not making very much, working. And so therefore she would still qualify for cash assistance, which to me, it makes no sense. You know what I
Makes
mean?
no
And so
sense.
we're pitting two, like, one against the other because we need to raise the minimum wage. At the same time, we're saying that we won't raise the cash grant either, to support moms like her who's working hard, who's doing the best she can. And there's trust me, I can tell you from experience, no one as a child says when I grow up I want to be on welfare. It's not, it's not a great experience. And
Right.
no, these people are living in extreme poverty. They are living at about 21% of the poverty level, right? So this is
What does that
extreme.
mean when we say that 21% of the poverty
That
level?
means that the federal poverty level, at 100%, is probably about, I think it's probably about 19,000, 21,000, something like that. For a family of, this $316, a single mom, one child. So if she's making minimum wage at 100% of the poverty level, these families are living there's 21%. They're nowhere near 100% of the poverty. So the amount of money that they're receiving puts them at the very bottom of the rung when it comes to the federal poverty limit, level in this country. And so they are no better, they're not a whole lot better off, right? And so they are still struggling to make ends meet. And all the other, I know people who speak against it say, well, they get, food stamps and they get medical and they get housing assistance. And why do they need more money? Right. And so that's not always true, right?
Right.
Housing is subsidized and there's limited, it's appropriated. So there's not, it's not a
There's
endless bucket
waiting
of money.
lists for
There's
it.
waiting lists for it.
Mhm.
Absolutely. And even with subsidized housing now, there are rules that even with subsidized housing with a small amount of money, as much as $316, they would still be required to contribute to their housing. So
Right.
money still has to come out of that, right? And so, food stamps, yes, they get money for food, but that often the food stamps, the food runs out third week of the month, that even doesn't even stretch. So the reality of it, if you've never lived it, you don't really understand it. For looking from the outside in, it would seem like, why do they need extra cash when they have all these other supports? You know what I mean? And medical assistance is the same. It only pays for medications that are prescribed. All the over the counter medications, has to come out of pocket, right? Out of that, that household's, cash grant, whatever it may be, whether it's 316, 403, whatever that
It
is.
sounds to me, listening to this too, Rochelle, that what I'm finding fascinating is, okay, you can work full time, still not make enough to make your ends meet, need cash assistance. So, really, isn't this a corporate welfare program? Because what we're saying is you can work at a big box store that's paying minimum wage, and basically the government is subsidizing
Yep.
those private industry wages. So,
Yes,
we're the ones really getting the welfare here, right? Which
absolutely.
is very bizarre to me. And yet, our rhetoric, our way of spinning this in media is to blame and to stereotype,
To
you know,
shame and to
and
shame.
to shame, single moms, many of which, are portrayed as being black. And so you're creating this whole racist narrative
Mhm.
around something when really we should be directing our anger at these corporations that are getting away with not paying
Absolutely.
people a living
Absolutely.
wage.
Yeah. And so, there are our neighboring states, many of our neighboring states have already, he took heed, to the call and have raised their cash grant. West Virginia, Maryland, Ohio, Pennsylvania is the last state that's just kind of hanging out there. We've been fighting for a rate, an increase in the cash grant. And the kicker here for people who are not familiar with, how this works, TANF is federally funded, but the Pennsylvania is required to match what the federal government puts in.
Hmm.
So it's called maintenance of effort. And so they match. And so it's a block grant. It's block granted, which is how it's funded. And that block grant hasn't changed since 1996 when it was reformed. So we're receiving the same amount of money from the federal government every year, but the cash grant caseload has decreased by more than like 70%. So that money ends up going into a reserve. And so we use that money sometimes for other things that are not associated with cash. So we're putting that money elsewhere instead of putting it in the hands of families. And then part of it is just sitting in a pot in a reserve, just for what some may call a rainy day. So in essence, what I'm saying is that increasing the cash grant will not cost the state any money. It does not, there is no additional revenue that's needed. We have enough in reserves to pay for a cash grant increase. So really at this point, it really is about priority, right? So it's about this is not just it's a moral issue, but it's also an equity issue because currently right now, more than half of the people who are receiving cash assistance are Black women and children. And so as a state, if we want to do better and we want to step up and we want to make a statement and show that we are putting forth an effort to create equity across the state and on all fronts, including the benefits and services that we provide to our families through health and human services, then it behooves us to raise the cash grant, especially whenever it's cost neutral, right?
Well, and that makes total sense. So what I'm hearing is we should dare to care about this because it's not only a moral issue and an equity issue, but let's be very pragmatic here. It sounds like an economic issue too, because you
Absolutely.
are sort of the person that can really say, "Hey, I used this assistance when I needed it, and
Yep.
now I own businesses. I'm a contributing member to our community. I have, grandchildren." Like you've been able to, lift yourself up
Yes.
utilizing these social safety nets, which I think if we could just get past this stigma that
Period. Yep.
America has
Yep.
around social safety nets, we could really be improving individuals' lives, which of course, as we know,
Yep.
improves the collective.
Yep, absolutely. I mean, that's because I'm a perfect example. This is what a cash assistance consumer looks like. Me, I'm
Mhm.
her. I was her, but I'm paying it forward now, right? So, like you said, it's a hand up, not a handout. It's the right thing to do, particularly when we say that we care about kids, because more than 1 in 3 Black and Latinx children live in poverty in this state, right? So
Mhm.
this is more importantly, it's not just about these single moms, it's about the children, right, who are experiencing extreme poverty when we have the means to do better, right? We
Yes.
don't need, tax cuts and tax breaks. We can, we have all this, all these things that we're at the end of the day, you know what I mean? Who's suffering the most in this and the most vulnerable amongst us to provide that. We've got some fact sheets. There's information on our website about TANF. So I would just urge people to, to just read up a little bit more. And if they want to know, you know what I mean? Like I said, if you want to know a person, what does, someone who on cash assistance looks like, I'm her. I mean, I'm not on cash assistance now, but I'm same person I was 30 years ago. You know what I mean? Nothing's changed except for the fact that I used it as a resource to get ahead, to make a difference in my life so that I can make a difference in other people's lives. And so that's really what it's about.
Rochelle, thank you so much for being a part of Dare to Care and talking about an issue that is often hidden and stigmatized, like you said. Can you share your website so that people can check it out?
Yes, www.Black Women's Policy Center. That's Black Women's with an S, not apostrophe, blackwomen'spolicycenter.org.
Thank you so much.
Thank you for having me and for talking about this very important issue.
Thank you so much for joining me for this month's Dare to Care. Do you have an issue that matters to you and you think more people should care about? Let's connect. Find me on social media at Natalie Bencivenga or email me at admin@nataliebencivenga.com. I dare you.